Wednesday, July 8th, starting at 6:31 p.m. I'm going to start with a roll call. Councillor Clark.
Present.
Deputy Mayor Aberhardis.
Present.
Councillor Hudson.
Present.
Councillor Smith.
Present.
Deputy Clerk Gail Miracle.
Present.
And CAO Christine Martin.
Present.
Thank you very much. May I please have a motion to adopt the agenda?
I move with all the amendments that were made over the course of the week.
Thank you very
Everhardis.
much. May I have a seconder for that, please?
Councillor Hudson.
Okay, I will take Councillor Hudson. I heard her first, so I have a mover and the deputy. I have a seconder by Councillor Hudson. Any opposition? Hearing none. Carried. Number 3, disclosure of interest.
None, Your Worship.
I'd like to let council know that I will be declaring disclosure for 10.1 due to a severance that's being applied for by myself and my wife for property that we own in Toronto. At that time, I will give the chair over to the deputy mayor. So hearing no other disclosure, carried. Moving on to the approval of the minutes, we have the approval of minutes of the June 24th regular council meeting and the minutes of the July 2nd planning meeting. What are council's wishes?
I would move acceptance of both of those found to be correct.
Thank you very much, Councillor Clark. May I have a seconder, please?
Councillor Hudson.
Thank you. I'll take that. Any questions from the minutes? Any objection? Hearing none. Carried. Tonight we actually have 2 deputations. I believe this is the first deputations that we've taken so far as a council through Zoom meetings. The first deputation is going to come from Dr. Alexa Cadaret, who is the acting medical officer of health for Hastings Prince Edward County. She's going to discuss the current COVID-19 response measures put in place by the health unit. I'd like to welcome Alexa to council, as well as I would like to offer my sincere thank you and that of the town of Toronto for all the efforts being made by the health unit during this time. So, Dr. Cadaret, you have the floor.
Thank you so much for that, and thank you for the opportunity to speak with you today. Can you hear me all right?
I can hear you fine. Everybody else good?
Great. Okay, and I just want to check to make sure that everybody has the information package that we've sent along.
Yes.
Yes.
Okay, perfect. So I wanted to speak with you a little bit today about some of the work that we've done at the health unit to date in terms of our COVID-19 response, and then some of the work that we are doing moving forward through phase 2 and then looking into the future as we continue to respond to the pandemic. And we're going to talk a little bit today about the epidemiology and transmission so far of COVID-19, our role here at the health unit and our local intervention strategy, how we've been trying to prevent the spread locally of COVID-19, masks and face coverings, which I think are the sort of hottest topic of discussion at the minute, what we're thinking around in terms of planning for a second wave, and how we're going to maintain vibrant and healthy communities as we move forward together. If you move to the next slide, I'll speak a little bit to local epidemiology. As of July 6th, which is when we pulled this information, though it has not changed subsequent to that when I checked with our epidemiologist today. And for some context, if you thought about the world picture, so the World Health Organization declared COVID-19 a pandemic, as you'll recall, on the 11th of March of this year. This is a disease unknown to science at the beginning of this year. And so if you think about the context of where we have come so far, and this is a big sort of movement that we have taken collectively. And locally, we have 43 lab confirmed cases of COVID-19, 1 active case, which we consider at the health unit to be medically resolved. We are just pending one more negative test result for that person. 37 recovered cases, 5 members of our community who have unfortunately died from COVID-19, 22 cases that we can link to community spread. If you move down to the next slide, when we think about roles for the team at Hastings Prince Edward Public Health, we provide things like local recommendations. We provide input in terms of a testing strategy for our community. And we provide case management as well as contact tracing. Those will be things that you've heard about on the news. So we get in contact with every person in our community who tests positive. We find out about their contacts and we get in touch with those people so that they understand what the requirements are for them to stay home to prevent further spread. And we do inspection of places that we normally inspect and enforcement if it becomes necessary. We provide ongoing support to businesses if they have questions or concerns about how they are able to safely operate. And then we collaborate with municipalities like yours around what kinds of things are necessary for enforcement and what other things need to be in place for you to conduct your normal business. If you think about those roles, you know, I really want to recognize all of the members of the team at the health unit for all of the really extraordinary work that they've done. This is an unprecedented kind of situation. We have not responded to a pandemic of this scale in any of our lifetimes. The last time something of this magnitude happened would have been in 1918, when none of us were alive, certainly. And it is unlikely that any of us will see something of this scale and scope again. We have had a full-scale redeployment of our staff and working flat out for a really long time, particularly given, you know, things like the repatriation here. And our staff have been working for a really long time and working really hard. And, you know, I really want to recognize all of that incredible work. In terms of the specifics around some of the things that we do, you know, the recommendations mean things like working with partners to apply the points that we get from the province at the local level. We provide regular updates and clarification for our local partners to make sure that we're all in compliance with the provincial guidelines. And we develop local recommendations for instance, our local healthcare partners, for you, the municipalities, community partners where required, to support whatever are situated around locally. In terms of our testing strategy, we initiated local testing options at the outset of the pandemic with a focus particularly on healthcare workers because we recognized that that was an area of need and we wanted to make sure that our capacity in the healthcare system was there to make sure that everybody else was safe. We support our partners from the healthcare sector to implement the longer term testing strategy. We were working to ensure that we had adequate testing supplies for our region. So we had people in particular working on things like making sure that our partners had swab kits available for them. We worked to implement the intake line to support residents for accessing assessment and testing, and that's something that's ongoing. So we will direct people to assessment centers if and when that becomes necessary. We work with our community partners to ensure that people are being appropriately directed to testing when they need it. And then we do some work around specific testing campaigns when called upon. If you look at the next slide there, you'll see a graph that shows all of the different assessment centers and how they've been used over time. And you can see that there's been an incredible ramp up of testing over time in all of the different centers. If you come down to the next slide, it speaks a little bit more to case and contact management specifically. So some of our roles there are in terms of things like responding to public inquiries, offering assessment through our intake lines, receiving test results from the assessment centers, hospitals, and our paramedicine partners, and then doing some of that contact tracing that I spoke for probable cases, outlining isolation requirements to keep people safe, and then providing things like return to work or return to school clearance once cases have resolved, and helping people understand what a resolved case means so that they can get back to their regular lives. We also provide the means for people to isolate in place if they don't have them. So we provide people with information around things like groceries, if they are unable to do so, if they don't have the means to enable people to do that, again, to help keep everybody safe. In terms of inspection and enforcement, we work in partnership with our municipal partners and the police to support compliance with all of the state of emergency orders that exist. And to avoid duplication with the municipalities, we've organized this work around the emergency orders on the premise that things that fall under public health oversight, we continue to do, and things that fall under the oversight of our municipal partners, they're going to continue to cover off. In terms of our support for small businesses, if you come to the next slide, we've connected our businesses with resources. We're providing sort of broad recommendations for sector-specific concerns, particularly around safe operating requirements. We've linked to things like fact sheets on our website, and our approach to enforcement is progressive enforcement. Our objective is really to provide education, resources, information to our business partners to help them operate safely. Our goal is not to be out there fining people. Our goal is really to enable people to operate safely. We operate a healthy workplace resource line, which is staffed by our public health inspectors, that provides sector-specific resources from the Ministry of Health that we link to, and we will provide assistance to our business partners in terms of interpreting those. We don't provide one-to-one consultations for businesses in terms of their specific plans, but we do provide frameworks and some assistance in interpreting things where things might be unclear. In terms of our role in collaboration with the municipalities, we try to provide some situational awareness through some weekly calls, as well as the bulletins that you will have seen, as well as ad hoc calls when they become necessary. We collaborate to enforce those emergency orders, like I've said. We provide the scientific and evidence-based consultations around best practice, and we work together to promote messages about things like infection prevention and control, physical distancing. We're collaborating with a variety of municipal departments, for instance, around long-term care, bylaw enforcement, and community development. If we think to some of the local intervention strategies that have been successful so far, I would point to things like the repatriation effort that happened at CFB Trenton, some of our initial testing for urgent cases, particularly healthcare workers, while those testing centers were being enrolled in, support for referring to testing centers, advising and enforcing some of the isolation for probable and confirmed cases, contact tracing the confirmed cases, which we've been able to turn around within 24 hours of receiving a lab result, communicating and enforcing infection control requirements to the public and to commercial settings, and enforcing limitations on social gatherings, and issuing strong recommendations for face coverings, which we'll come to in just a few minutes. Our intake line at the health unit operates 5 days a week at this point. When we initially scaled up our operations in March, we operated a 7-day-a-week intake line at the outset of the pandemic. We provide general information that responds to questions and concerns. We provide assessment, we provide referrals to testing centers as appropriate, and to date, we've received over 9,000 calls through that line. And in terms of how we're helping to prevent spread of COVID-19 in the community, we recommend 5 fundamental steps to everyone living in this community, and they're all the things that you've heard. So all of the things that we think are really important when we think about how to prevent transmission of disease to reduce everyone's risk. They're staying at home when you're ill, keeping a physical distance of 2 meters from anybody who's not part of your social circle or household bubble, wearing a mask or a face covering when that physical distance is difficult or not possible, practicing good hand hygiene and environmental cleaning, and making sure that you're screening anybody who is, for instance, coming into a facility and sending in testing who's concerned about a potential of transmission. Coming down to the next slide and talking a little bit about face coverings, I want to emphasize that we've had no local cases reported since the 18th of May, and we're considering all local cases in the area to be medically resolved. We've issued previously strong recommendations for face coverings when physical distancing is not possible. And we want to make sure that we prioritize capacity at Hastings Prince Edward Public Health for all of the things that we know are going to keep the public safe. In the same spirit that, we want to make sure that we maintain your capacity at the municipalities for the work that you're doing that is equally important in terms of keeping everybody safe and getting city services back online. We really think that redeploying public staff to enforce things like mandatory masking would compromise the integrity of some of those high priority services, things like homes, making sure that we have staff available for immunization. That's why we haven't moved forward with something like a Section 22 order. However, there are provisions under the Emergency Management and Civil Protection Act and all of its related regulations that enable the health unit to issue instructions via the medical officer of health that we've done this week. Those instructions from myself enable us to instruct commercial operations to have a policy in place that prohibits people from entering the premises if that person is not wearing a face covering. We've also provided instructions for all of those other measures that I just spoke about. So it's all part and parcel of keeping people safe. Those instructions include having the availability for to wash their hands, for signage that indicates that people cannot come onto the premises without having a mask or other face covering available, for people to stay home when ill, for screening. So it's part of the entire package. The face coverings need to be worn inside the premises at all time, unless they're reasonably required to be temporarily removed to receive the service that the establishment is providing. And there are exceptions to these instructions. For instance, people who, for medical reasons, cannot wear a mask or a face covering, small children who can't wear a mask or a face covering, people who wouldn't be able to safely keep one on. These instructions come into effect this coming Friday at 12 noon. If you come down to the next slide and we think forward into the future, I want to emphasize that these instructions, masks, face coverings don't replace all of the things that we're already doing. We need to remain vigilant. We don't want to see a resurgence as we move forward into the future like we've seen in other places as they've started to reopen. Hastings Prince Edward is re-engineering our day-to-day operations to make sure that we have continuity of service if and when a second wave occurs. I think we'd be really fortunate in this area that we have had such a long time with this. Our reality is that we will probably see another case again, but we want to encourage our partners, both in municipalities and across the system, to develop resilient, really modernized service models in anticipation of a time when we will probably see increased activity again. But we also, we want our message to be that right now, as we move through this phase, we're providing everybody with the skills and tools to protect themselves and others well. We think this is a good time to develop those tools that we will need moving into the future. And we want to encourage really robust participation in those routine seasonal immunization programs. For example, the flu vaccine to protect the whole population and to reduce the burden on the entire system. In addition to our COVID-19 incident response, we're supporting enhancing all of the conditions to enable us to live, work, learn, play in a community that's really healthy, one in which we're all working together to stay healthy and to stay well. We're dedicated to working with you to make that happen. And we can provide things like access to data, consultation, support, advising and implementing any of these pieces of work where you think it would be helpful to you. So as we move forward, I want to remind you that if you think back to early April, when you may have seen some of the press releases or about those initial models of how long we anticipated this pandemic to last, they spoke to an 18 to 24 month total length of this pandemic. We are now in early July, so we are approximately 6 months into what is an 18 to 24 month period of time. We really need to work together to develop safe spaces for our communities. But to balance that with that need for precaution and protection with all of the requirements for everyday life, the ability to move about in our lives in a way that feels safe. We recognize that the public is concerned and that they've worked so hard to take all of the necessary precautions to get us to this point. We hear, and we have good data to support that the vast majority of Canadians have asked for this. They've asked for things like masks to be made mandatory as we move about in public settings in order to feel safe enough to do that. So, pardon me. We're trying to be adaptive and responsive. We know we can't predict the future. I can't tell you when our next case is going to come. What I can tell you is that at the health unit, we're ready to respond to it. Part of our response needs to make sure that we don't leave people behind. We want to make sure that our interventions are equitable, that we're being realistic, that we're making sure that what we put into place still leaves everybody able to participate in day-to-day society. And we know that together we can help to restore that confidence in the benefits of the efforts that everybody's taken to date to find a way to go about our regular lives as we move forward. I will leave it there, and I will reflect back the thank you that you started this meeting with to you, our municipal partners, our partners in the healthcare system, and our partners across the community at large, particularly everybody who lives in our communities, who, again, I recognize have incredible sacrifices to get us to this point, and my team at the who have been working so very hard.
Thank you very much.
Through you, if that's okay.
Yeah, I'm about ready to open it up to the table for questioning.
I just
Gladly.
wanted to make a statement that I really appreciate the work that the public health has been doing, not only in our community, but abroad. And this presentation has really put light on how much effort the public health has done and how much that has affected our community on a small scale, but as well as large scales with the communities that are around us. So thank you for the presentation, and thank you for everything that the public health has been doing to keep us safe in this unprecedented time.
Thank you.
Does anybody else from council have any questions for Doctor? If not, I would like to take a motion, please, to receive the presentation.
Councillor Hudson.
Thank you. May I have a seconder, please?
Deputy Mayor Everhardis.
And I'll take that. Any objection? Hearing none. Thank you. And once again, Dr. Cadaray, thank you very much for your presentation. It's always nice to hear it right from the person who implemented the changes. So thank you very much. Very much appreciated.
Thank you all for your time. Have a good evening.
You too. Moving on to 5.2, we have a deputation from Maya Navrat, the Education and Stewardship Coordinator for Quincy Conservation, to speak about a planning plan for the shorelines in Centennial Park.
Okay,
Maya,
hi there. Can you hear me okay?
Yes.
Okay,
Yeah.
Wonderful. Well, thanks for the invitation. Quinte Conservation received funding for 3 years worth of shoreline plantings through the Ontario Trillium Foundation, and this is in partnership with Watersheds Canada. So we've been offering fully inclusive shoreline planting program to private landowners on waterfronts, to farmers as well. We've been planting agricultural buffers along shorelines. And then part of this grant was to also plant shorelines as demonstration areas in municipal parks or on public property. So I approached the town of Deseronto to see if you were interested in having one of these demonstration plantings with signage at one of your parks. In particular, I was thinking the Centennial Park. Now, does everybody have the handout in front of them?
Yes.
I don't,
Yeah.
you get it? Okay, because I sent it in a little bit late. I was on holidays last week, so I'm glad that you received it. So as a conservation authority, we're very interested in seeing more natural shorelines for a number of reasons. One of them is protecting water quality. And so there in Deseronto, you're on the Bay of Quinte, which is one of those key water bodies that we've been working to clean up for quite some time. And so the natural shorelines, they have a number of roles, and one of them is to slow runoff water. And then as it's slowing that runoff, it's filtering out excess nutrients, the plants along the shoreline. And then the water draining down into the lake is and has less nutrients in it. So it also has the ability to cut down on things like excess weeds and algae growth. It also enhances habitat for a lot of wildlife, and it protects the shorelines from erosion. So the roots hold the soil in place. Also the shrubbery, the branches, and the leaves soften the impact of waves. So it helps to protect our shorelines. And so for the municipal parks, there would be, in this case, no cost to the municipality because that would be funded through Ontario Trillium Foundation. And then we have stewardship funding through Quinte Conservation and other pockets of money as well. When private landowners participate in the program, they have a 25% cost. And then the process is first a site plan is developed. And so if we do want to move forward with Deseronto, if you'd like to do this, we would work with your municipality, could be your staff and or council members, to develop a plan. And with a plan, we're always looking to maintain access routes to the water. There are always areas that landowners want to keep open, and definitely looking at maintaining water views. As we know, that's a real feature of having a waterfront property. And so a lot of these plantings we plant with flowering native shrubs and wildflowers and a few key trees. But really focused on maintaining those views. So do you have any questions for me, or do we want to have a little bit of a discussion about whether Centennial Park would be an appropriate location?
Sure. That was going to be my question, is how we came up with Centennial Park as the test site.
How I came up with that one?
Yes.
So the town of Deseronto did planting there with Quinte Conservation a number of years ago.
Mm-hmm.
And there is some of that remaining. When I passed through Deseronto, I saw the potential to put in some areas and bring some of that buffer back. I would suggest this time that the municipality consider putting in some flowering shrubs as opposed to what I remember to be a lot of wildflowers. That can be a little harder to maintain that look that you might be striving for. But we're absolutely open to any other municipally owned lands you'd like to see planted through the Natural Edge program. And on that note, I'll just tap in that there are a lot of tree planting programs that we're connected to as well. So if the town owns property, even if it's not on waterfront, that you would like to bring back to forest with trees, I can help connect you to those programs as well.
Thank you very much. Sounds like a wonderful opportunity for the community. I'm going to throw it out to council and see if anyone has any questions for you.
Your Worship, Deputy Mayor Everhardis.
Yes, you have the table.
Thank you. I would like to thank Maya for taking a phone call earlier. We had a good discussion about the waterfront and the potential Deseronto has to preserve its shoreline and enhance it through this program. I had a great conversation about this is a possibility for Arctic Gardens as we are looking at development in that area. Preserving that shoreline would be paramount for our community. We all know that there is prime turtle habitat there. That site is just craving for some TLC. Also, for council's information, I also suggested that we look at the property on the corner of Mill and Water Street next to the water treatment plant. That is also municipally owned, and that shoreline there is becoming more and more of a great spot to put in a canoe, a kayak, a paddleboard. It is an easy shoreline, and preserving that would be really important because unlike Centennial Park or the Arctic Gardens property, that is getting the full brunt of the southwestern winds when the waves kick up. There is no peninsula protecting that. So there's plenty of opportunity with this program. And after the discussion, I'm prepared to make a motion directing staff and council to enter into a plan with Quinte Conservation to determine the best location and get some of these plantings started. Thank you.
Thank you very much. Any other questions from the table? At this time, I will take the deputy's motion, if you'd like to make it.
Thank you. I move that council enter into partnership with Quinte Conservation in order to explore a spot for a waterfront, water's edge planting.
May I have a seconder, please? Is that?
Councillor Hudson, I would second. I just do have a question to continue discussion.
Yes, so I need a seconder to get on the table. So are you seconding the motion?
I will second to get it on the table for sure.
Thank you. It's now on the table. You have the floor.
So looking at the pictures from the presentation, are beautiful, the before and after. So for me, I think my mind goes towards Arctic Gardens, which is what I would like to see this project go towards. So I know we put it on the table in a motion for discussion, and for Quinte Conservation to go forward. I think maybe the gap there is which properties we are going to go forward with.
So, Your Worship, if I may comment?
Absolutely.
Thank you. The motion is open-ended to find the best location, whether it's Mill Street, Arctic Gardens, or Centennial Park for this, Councillor Hudson. The idea is
Right.
This is broad-minded. This is something that hopefully we can see the success of and do again.
And for myself personally, through the chair, my mind goes towards the development of Arctic Gardens, as Centennial Park is beautiful and has a lot of the things already that we would like and a plan moving forward. So Arctic Gardens for me would be kind of the ideal place for this project to move forward. I'm not sure what everybody else was thinking.
I would say at this point in time, I believe the motion is to get all that information, compile that information, and bring it back to council, and then council will then have a further discussion and then give further instruction of what site is going to be selected for the rehabilitation. Is that correct? I believe that's how I'm interpreting that motion.
That would be correct, Your Worship.
Thank you very much. Is that clarity, Councillor Hudson? And does that answer any concern that you may have?
Yep, very much so.
Okay, so I have a motion by the Deputy Mayor and you have seconded it. Any further questions or clarity required?
No.
Any opposition? I'm hearing none. Carried. I'd like to thank Maya for this presentation and for thinking of our community when looking at these type of programs. I'm very, very excited to be working with Quinte Conservation on this initiative. Thank you very much.
Great, thank you. I look forward to working with you all.
Take care and have a great night.
You too.
We also have a motion, please, to receive the report.
Everhart is moved.
Thank you. Seconder, please.
Councillor Smith.
Thank you very much, Councillor Smith. Any objection? I'm hearing none. Carried. I'm just going to take a moment for everyone to move on to the variance report. So we have the year-to-date variance report as of June 30th, 2020. Anyone have any questions? If not, may I have a motion, please, to get it on the table? For acceptance? Thank you very much. May I have a seconder, please?
Councillor Hudson.
So I have a motion to receive the report by the Deputy Mayor, and I have a seconder in Councillor Hudson. Any questions or clarity required from the variance report as presented? I'm hearing none. Any objection?
None if proven to be true.
I'm also hearing none. Carried. Thank you very much. Next item of business, we have the approval of the accounts. We have a schedule of accounts 12-2020 for the amount of $58,818.91. What are council's wishes?
I would move acceptance of the report, Your Honour, if found correct.
Thank you very much, Councillor Clark. May I please have a seconder?
Councillor Smith.
Thank you very much, Councillor Smith. I have a mover and a seconder. Any questions or clarity required? Any objection? I'm hearing none. Carried. Thank you very much. Next item of business, we have staff reports 8.1. Does everyone have 8.1 in front of them?
Yes.
Okay, then I'm going to move forward. It's a report from the community center lead hand with respects to a possible, I guess, the etiquette for a gym opening when we get to that point. May I please get a motion to get this report on the table for discussion?
Councillor Hudson.
May I have a seconder, please?
Councillor Smith.
Thank you very much. It's on the table. I know I'm a little bit out of order, but it came up a little out of order for me. So I will go back to the community lead hand report for July 8th. So right now I'm on the gym etiquette portion. So it's out there for comment. Councillor Hudson put it on the table. You have the opportunity to speak first.
I feel the report was well put together. I think it's a good approach to coming back from the pandemic, and I look forward to comments from the rest of council.
Thank you very much. Councillor Smith, you're the second up.
I have nothing to say. I agree with the report.
Thank you very much. Any further questions?
Deputy Mayor?
Yes, you have the floor.
I just have a brief concern. It says that the gym will reopen on August 4th. We all know that that is controlled by the provincial emergency order and any subsequent legislation that comes along. Also, after reviewing the list of etiquette, unfortunately, in this time, this would work in a non-pandemic situation. But in this time, I'm feeling that it's a little bit too much bearing on the patron and not enough on staff. At this point, who's to ensure that machines are wiped down? That is a huge infection control thing. There is a lot of voluntary looking things in it. It needs to have, definitely, if we reopen the gym, there needs to be more of a staff presence to ensure things are being done correctly. It also does not mention the number of patrons in the gym at a time. That's problematic because there would be definitely limitations with the space. Well, 3 per user per hour, but how does that work, right? So we need also to talk about a software thing or a phone to book this. I'm seeing that this is a work in progress, and I think there needs to be a little more refinement as we move closer to the stage 3 opening, if gyms are able to open, and B, if there are guidelines that industry has put out, our gym needs to follow those guidelines. Thank you, Your Worship.
Thank you very much. So I got a motion on the table to accept the report. Part of that report is also the quote for the roof as well for the arena and the community center. As far as the gym opening goes, I think this requires a little bit more conversation before we move on. Some points have been raised by the deputy mayor, but I do have a motion on there to accept this portion of the report.
I think, Your Worship, if I can offer a point of order, I think you asked for a motion to get it on the table.
That is correct. Thank you very much. So I'm having trouble with it because there's 2 points. There's action items plus there is the report. So let's talk about the fitness center. We'll take that as a separate. Would council like to see staff go back and take a look and just fill in a few blanks? I know from conversation I've had with the CAO that there is a staff component, but maybe for the sake of council, that can be articulated in a document. Christine, do you have comment?
I guess I thought I was clear in the report, but apparently I wasn't. Sometimes I read things and I know what I'm talking about, but I'm not conveying to you. Brenda and I have taken some time to think about all those things, Deputy Mayor. The bookings would be done through Brenda at the arena and through here, through an Outlook spreadsheet, like their normal ice surface or ice rental booking. And we have compiled the list of the regular users that will be contacted first. The reason for the hour in between the appointments is so that Brenda can go in and completely clean and disinfect all of the equipment and the washrooms before the next group of street comes in. So, I mean, I think this is it's a pretty good system. I think we've covered all the bases, even though it may not come across in the report. But I understand, you know, the concern, especially when we're moving to potentially face backs on Friday. And I don't know how many other gyms are open. I know maybe there's some private ones that have opened up as commercial businesses, but we're talking a municipal facility. So there is a difference there. And I've just made a recommendation, but I'm leaving it. It was a proposed. So really, we're in a position where we can open by August 4th. That doesn't mean that we should. It's council's decision.
Your worship, if I may have the floor.
Absolutely.
Through you to the CAO, thank you for that clarification. I now see the idea here where the operating hours and the appointments relate to each other. That makes a lot more sense after that explanation, and that actually takes some of my concern away. I think if we're in a position to open by August 4th, the next discussion is, will we when that time comes? I think it's important that we're in the position. I think this makes a lot more sense now that that information has been shared. So thank you to you, Christine, for that clarification.
Thank you. The next piece of item is just of information is just simply that. It's information from staff indicating issues with the roof and a possible restoration of that roof. But I believe at this point in time, it's just information to council for us to mull over and think about for a future conversation and future recommendation coming from staff. Am I correct, Christine, with how I'm interpreting that?
Absolutely. Yeah, we're waiting on the ICIP recreation stream funding announcements. But in the meantime, I felt I should put this in front of you so you were aware of what's going on.
Thank you very much. So it's just simply for information purposes. So with that being said, we've had some healthy discussion. I think we received some clarity with respects to the gym opening, as well as we've received the information regarding the roof. I will now ask for a motion to accept the report.
I would move that motion, Your Honor.
May I have a seconder, please?
Councillor Smith?
Any objection? Hearing none? Carried. Thank you very much. Next item of business is 8.2. It's a report from the transit manager. Does everyone have that information up in front of them right now? If they do, we'll take 8.2, I guess.
There's two.
Yeah, so I guess A, 8.2A, I guess, or 1. This one here is fares associated to the reduction in costs due to reduced service. So I think everyone's had a chance to go through this. The recommendation from staff is to receive the report. May I please have a motion from council to get it on table for discussion?
Everhart is so moved.
Thank you. May I have a seconder, please? May I please have a second from council to get this on the table for discussion?
Councillor Hudson.
Thank you very much. I have a mover and the deputy. I have a seconder in Councillor Hudson. Deputy Mayor, you have the floor.
Thank you, Your Worship. Looking back to the minutes of the last meeting, there was a request for information for contactless payment options for transit. Looking at this report, unfortunately, sometimes, Your Worship, it seems that you ask for a bag of apples and you get a jar of pickled eggs. This report is, I think, doing something a little bit different than what we've requested. I believe it's moving forward with the idea of free transit as a pilot project. Unfortunately, during my review of this report, I'm puzzled by the fact that, pilot projects during pandemics might not necessarily be the best way of moving forward and building confidence in the service. So I would be opposed to continuing the free service past the deadline we have moved forward with. I would strongly encourage the committee to investigate a point of service payment system other than cash. I think they have subsequent reserves that they could purchase such a thing for the one bus they are using. But it is, we are being requested later on to move back to normal or more normal business. I think it's incumbent on us that we start collecting the fares that are associated with that.
Thank you very much. Councillor Hudson, you were the second on that motion. Do you have any comment?
My only comment going through the report, in a sense, I agree with Deputy Mayor in understanding where the free pilot goes to, and then at the same time how we can utilize and make our transit something that is super beneficial to the community. So I understand that pandemic's a weird time for that, but yeah, that would be my only comment towards that.
Okay, so we've got two conversations going on here, two separate reports. I think we've kind of broached a little bit of the second report as well into the first report.
Which report are we looking at, Your Worship? I'm getting a bit confused here.
No, I understand that. 8.21, which is, it's titled July 7th, 2020.
Through you, Your Worship, I have two as well. Is it beneficial to put them in the same category?
Well, I can. If you guys would like to amend your motion, Deputy Mayor, to include 8.2B as well into this conversation to get on the table,
I would be more than willing to.
Thank you very much. And Councillor Hudson, do you have any issue with being the second on that?
No, not at all.
Thank you very much. Okay, so now both pieces of correspondence is on the table. Okay, so Christine, can you clarify, is the motion on the table to extend the free fare ridership to July 15th? Or what was the date? I'm sorry, I should have asked you in advance.
I'm thinking are you looking at the committee recommendations or Jenny's report, the one that was sent to you today?
I'm looking at everything right now. I'm trying to figure out which one is aligned. So part of my confusion here on this, I'm seeing a staff recommendation to council from the steering committee, and I see two of those. That was from today. And no, I see
those are item 8.3. The committee recommendations are items 8.3.
Okay.
Benefit analysis and the COVID AM shift reopen. Okay, the transit management report is the ridership report, which the manager has been providing each meeting.
Okay.
As requested. And
8.2 is the ridership report then, Christine?
8.2, the first one is the ridership report. 8.2, the second one is the report that I sent to everybody today regarding cashless options.
Okay, that's where I got a little confused because I was looking at the cashless options as 8.2A and then 8.2B was the transit manager's report regarding ridership.
Okay, those are the two we're discussing.
Okay, so they're both on the table. So the recommendation from the committee is 8.3. Okay, we're all on board. Is everybody on the same page with respect to where we're at?
I'm trying.
Yeah.
Your Worship, just to streamline everything, I think the report from the manager is straightforward, and I move the approval of that report, or adoption of that
seconder,
report.
please.
Councillor Smith.
Thank you very much. Any further discussion? Any objection? Carried. Was that both? Did that cover both reports, Deputy?
No, it just the ridership.
Ridership.
Report.
Okay. So now we're in the report re-fares and the fare boxes. And that was where your comment was directed with respects to the fare box options.
Yeah. And if I may comment, Your Worship, now that we're clearer,
Yes.
there's an impact that says we should extend free fares until a cost analysis is reviewed by the Transit Steering Committee. We have not asked them to do a cost analysis. We have not asked them to dive into that yet. I think there is new ridership. That's great. However, no transit system, not even the Peterborough Zoo train, operates on a transit cashless fare free long-term way. On occasion, events like major events like the Olympics, transit systems operate on a reduced fare, but generally this is uncharted territory, and I am very much concerned about moving into this during a pandemic. I would prefer to see our fares be reinstated at the time that was discussed last meeting. Thank you.
No problem. Councillor Clark, I'm going to have to ask you for comment. You are a representative on the board for, on the transit committee. Can you shed some light of where we're heading here?
Your Honor, I have to apologize. I wasn't at the meeting yesterday. I don't know where some of the where the views are coming from. I was under the understanding that I believe it was some date in July 15th or something like that we would start doing the fares again, but something has happened that view has changed, I think, and I don't really know where it has come from. I know there are more people wanting to use the transit, and more people are being called back to work every day, as I understand it. But why they're wanting to continue with no fares, I would have to ask the manager of that. As I say, I apologize. I couldn't make the meeting yesterday morning.
No, that's fine. Thank you very much. My only concern is I believe that the deadline is around July 15th, and I don't know how long it would take to find a cash pay like a payment option that is going to that's going to work within the time frame that's there. We've already started this service. We have it up and running. I don't see any information here letting us know how long would it take us to equip one bus with fare boxes if that's the route that council decides to request from the committee. My fear is if we do not know what date we're supposed to be going back with charging fares, and we're not equipped to do so, that we have stalled the transit service temporarily.
Your Worship?
Yes.
Thank you. I would agree with that. I'm looking at this as an opportunity for transit to continue to grow and get new passengers, but we cannot create a reliance on a fare-free system when we know in the future we cannot afford a fare-free system. I am all open for a discussion on readjusting our fares and looking at whether our fares to what we charge is reasonable, but that cannot happen at this point in the middle of the COVID crisis. It needs to be happening after the fact. We are also being asked in the next report to increase service even more. So there will be more carrying costs. That transit fare helps offset the carrying costs. So my suggestion would be that we are directing the committee or the authority, the transit authority, to start collecting fares, whether they whether they choose to do it without a cashless option. That's their choice right now. We've asked them for a report. We did not get that report. We need to move forward. We need to continue on collecting transit fares. We are in the state we are in with COVID. We will be wearing masks. We will have sanitizer. There will be plexiglass. We will be eliminating most of the risk. I think if transit is going to remain relevant, they're going to need to kind of fall in with the rest of the world and start resuming normal operations. They're asking for us to do that. In the second recommendation, we need to then have the finances coming in to offset the cost of running the program.
Oh, fair enough. So obviously we're not receiving the report as written. Do we have a motion to get on the table?
I'll move it and get that recommendation on the table.
Okay, so I've got a mover. Can you clarify your motion, please, Deputy?
Yes,
Just so we
thank
get a
you.
seconder.
That council directs transit to begin collecting fares and requiring tickets on the agreed upon date in July. And I believe that was July 15th, as Mr. Clark pointed out.
Thank you. May I have a seconder, please?
I'll second that motion, Your Worship.
Thank
Oh,
you very
sorry,
much.
Your Honor.
Thank you very much. So I have a mover in the deputy, I have a seconder in Councillor Clark. Any opposition? I'm hearing none. Carried. Thank you very much for the conversation. The next piece of correspondence is 8.3. It's a report from the Transit Committee meeting. May I have a motion, please, to get on the table for discussion?
Everhart is so moved.
Thank you very much. May I have a seconder, please? May I get a seconder, please? Thank you very much. I have a mover in the deputy, a seconder in Councillor Hudson. Deputy Mayor, you have the floor.
Thank you. I am pleased to see that this is moving forward. This is a logical progression in the service. My one concerning question would be, have we recalled enough drivers to provide this service with the extension of route times? A 5 to 11 a.m. shift, that's 6 hours. 11 to 5, that is 6 hours. And a discretionary 8 to 12 would mean that we would need more than one, if not two, if not three drivers to perform this service during the week.
So your question, whether or not we have enough staff to handle the increases?
Correct.
Thank you. Councillor Hudson, do you have any questions?
None, Your Honor, no.
Thank you very much. So I believe that the request here is to start opening up more trips and allowing the transit coordinator figure out a way to logistically put that together. Is that not the request that I'm looking at?
I believe so, yes.
Okay, so if we accept if we accept that portion of the report, we're going to allow the transit coordinator then to backfill those positions that are required to get the program moving. So that should address your concern, correct, Deputy?
I believe so. I just think we do have people furloughed right now.
Yes.
And their willingness to come back has an impact on the willingness to provide this service.
Absolutely.
So, yeah.
Okay, so so the current motion is to get on the table for discussion. May I have a motion then to accept to remove the essential trip conditions for riders at the discretion of the transit coordinator?
I don't think that was the issue, sir, Your Worship. Work is still an essential trip.
Yeah.
Okay.
It's just extending the service, and she has a driver lined up.
Good. So it would be I move that we extend the service to the hours outlined in the report.
Thank you very much. May I have a seconder, please?
I'll second it. Councillor Smith.
Thank you very much. Any further discussion? Any objection? Hearing none? Carried. I have to apologize. That was very difficult to navigate through. I did a lot of pre-work trying to get the agenda in order because as we know, everything came in a little bit, throughout the week type thing. That's just the nature of the business for this past agenda. So we got through it. Thank you very much, Council, for bearing with. So I believe we're able now to move on to 8.4, which is a report from the Water and Sewer Operations Manager. What are Council's wishes? May I have a motion, please, to receive the report?
I'll second that.
Thank you. We've got a mover in Councillor Hudson. We have a seconder in the deputy mayor. Councillor Hudson, you have the floor for discussion. Do you have anything to discuss?
None, Your Honor.
Thank you very much, Deputy Mayor. You're the second. Do you have anything?
I cannot see any issues with the report. They're continuing to do good work. Thank you to the Water and Sewer for continuing the operations that they're doing.
Thank you very much. So I have a mover and a seconder to receive the report. Any objection? Hearing none? Carried. Thank you very much. 8.5, report from the CAO. Report July 8th. May I have a motion, please, to get on the table for discussion?
Everhart is so moved.
Thank you. May I have a seconder, please? May I please have a seconder to get on the table for discussion?
Councillor Hudson.
Thank you very much. I have a move from the deputy, a seconder from Councillor Hudson. Deputy Mayor, you have the floor. There's lots to talk about.
Thank you, Your Worship. So in budget talks, we discussed increasing the cost of bag tags. This is, I think, something that we need to discuss and certainly consider. And I think we had some general consensus around the table that this was a great idea to align with the other municipalities out there. My one concern would be jumping it tonight would be catching people off guard after COVID. I think what we need to also consider is last year we had several bylaws to adjust our fees come at us at once over multiple times. I think the entire fee bylaw should be updated once annually. And I believe that we should do that after the council staff have time to create a comprehensive increase for all our fees. And I'd be willing to do that at the next meeting. But right now, I don't think that's appropriate to do these as one-offs. As for the water and sewer, increasing the billing starting June 15th, I hate back billing people in a time of high unemployment and the need for programs like SERVE. I would be willing to start that billing process for the September and October pay periods. We need to give the people a heads up in their summer bills that this is coming. Backing them up without getting the heads up does not look good for anyone. So that's my opinion on that one. I'm supportive of these ideas, but I would like to see the entire fee bylaw looked at as a one document, one bylaw once a year. And I would like the water and sewer increase to happen in the future, not in the past. Thank you.
Thank you very much. Councillor Hudson, do you have any comments with respect to the recommendations within the report as the seconder?
No, I think that was well said, and my points were put out there. So thank you.
Thank you very much. Any other comments with respect to the recommendations in the report before I ask the Deputy Mayor to put together a motion? I'm hearing none. So may I ask the Deputy Mayor please to put together a motion?
Thank you, Your Worship. I move that Council direct staff to prepare a comprehensive fee bylaw for 2020-2021 containing all fees which the municipality levies and present it during the first meeting in August. Second to that, Council approve the 2.5% water and sewer increase rate beginning in the September and October billing cycle.
Thank you very much. May I have a seconder, please?
Can I just,
Councillor,
Yeah, just 1 second, Christine. So I have a seconder and Councillor Hudson. Okay, so the CAO would like to make comment. Christine?
I just want to comment that I don't believe it's September, October. It's so June 15th to August 15th is one cycle. So it would be August 15th to September, October. No. Help me out, Gail.
August,
October
October is correct.
Okay. I just wanted to make sure the motion was correct. That's all.
Perfect. So with that clarification, Deputy Mayor and Councillor Hudson, are you still satisfied with the motion on the table?
I'm still satisfied.
Yes. So with that being said, any further questions or comments with respect to the motion? Any objection? I'm hearing none. Carried. Thank you very much. Next piece of correspondence is committee board meeting minutes. I have the Deseret Public Meeting Library minutes from February 26th. What are council's wishes? May I have a motion, please, to accept or receive the minutes?
Councillor Hudson, accept and receive.
Thank you very much. May I have a seconder, please?
Councillor Smith.
Thank you very much. Any questions? Any objection? I'm hearing none. Carried. Thank you. The next piece of correspondence is Quinte Conservation minutes from the May board meeting. What are council's wishes? May I get a motion, please, to receive?
Motion to receive, Councillor Hudson.
Thank you very much, Councillor Hudson. May I have a seconder, please?
Councillor Smith.
Thank you very much, Councillor Smith. Any objection? I'm hearing none. Carried. At this point in time, I'm going to give the chair over to the Deputy Mayor for action items 10.1.
Thank you, Your Worship. Looking right now, we have 10.1, a severance application B40-20 preliminary report. It is on page 109 and 123 of your package.
109 to 123?
109 to 123.
Okay.
Let's see if we can find that. I'm scrolling for it myself.
Thank you.
There we are. So what we have here, folks, looks like a lot division. 2 lots severed out of 1 on the far western part of our town on Main Street. You've seen the preliminary conversation from Gib Garrett, the planner at Hastings County. There's a site plan. There's the information. Is there any questions or comments at this time on that severance?
Just pulling it up, Deputy Mayor.
Thank you.
I didn't have any initial questions.
Thank you, Councillor Hudson. Councillor Clark, any comments or questions?
No, I'm familiar with this property, and I don't have any questions at all about it.
Thank you. And Councillor Smith, any comments or questions?
None at all.
Thank you.
I'm good with it.
Seeing at this point, I think it would be a received motion that we've received this and we've commented, correct, CAO?
And you're recommending consent be given.
Perfect. So may I have a motion to receive this and recommend consent be given under the authority of our council?
I would so move, Deputy.
Thank you very much, Councillor Clark. Can I have a seconder, please?
Councillor Smith.
Thank you, Councillor Smith. Any opposition? Hearing none, carried, and I relinquish the chair back to the mayor.
Thank you very much. Moving on to action items 10.2. I'll give everybody a moment to grab that up. 137.
137. Thank you. And I don't mean to, when you say 10.2, I was like, oh, thank goodness you said 137 because it's a little tricky for me.
If council finds that that's going to be more helpful, then I will definitely do that.
I appreciate that. Thank you.
No problem at all. So we have 10.2, which is education training opportunities, AMO, land use planning training. What are council's wishes?
Your worship, if I might comment.
Yes.
Considering we are in a position for the first time in a very long time in Deserano where planning is going to be something we're going to have to do, and we're going to have to be familiar with our roles under the Planning Act, especially when we sit in Committee of Adjustment, I would recommend that in lieu of all our conferences being canceled, that anyone who is interested in this training be authorized to take it.
So would that be your motion?
Yes, sir.
I will take that as a motion. Any seconder for that motion?
I'd second that, Your Honor.
Thank you very much. So I have a mover and the deputy and a seconder in Councillor Clark. Any further discussion? Any opposition? Hearing none. Carried. I would recommend anybody who's interested in participating, please let the CAO know, and possibly she would register you for participation. Thank you very much. Next piece of correspondence we have are information items 11.1 through to 11.4. I can take that all as one motion, or we can take them individually. What are council's wishes?
Deputy Mayor, I move that we accept all 4 items for information and receive them.
Thank you very much. May I please have a seconder, please, for that motion to receive all correspondence 11.1 through to 11.4?
Councilor Smith?
I'll take Councilor Smith. I heard that first. Any questions? Any opposition? I am hearing none. Carried. Thank you very much. We have no new business to report. We have no notices of motion. Just going to go around the table, see if anyone has anything to say before we start reading bylaws. I'm going to start with Deputy Mayor.
Thank you, Your Worship. I just wanted to draw Council's attention to the work that the library is doing to provide programming and things over the summer for all ages and groups. They're doing a bi-weekly bingo. They're providing craft kits and instructions via YouTube for kids. The craft kits are free to pick up. They're creating packages for adults who are bored out of their wits right now with social distancing. They're continuing to have tremendous success with curbside tip pickup. And once the library is able to open to the public, the staff are ready to safely provide library services in a more enhanced capacity than they're doing now. So kudos to the staff of the library and the Deseret Public Library Board, who are doing a good job at ensuring library services during COVID. Thank you.
Thank you very much. Councilor Hudson?
No comments. I would mirror what Deputy Mayor Everhardis has said, and I appreciate all the effort that the community has put in up to this point. And looking forward to a normalized, quote-unquote, summer.
Thank you very much. Councilor Clark?
I don't have any comment for tonight. Just it was interesting listening to the talking about doing the waterfront, planting various plants and so on. I probably will have something for the next council meeting to bring to council that involves Centennial Park and also the canteen. But as of tonight, I don't really have anything to say, Your Honour.
Thank you very much. And Councillor Smith, any comment?
No, I have none tonight.
Thank you very much. And I just want to reiterate that the town hall is now officially open for business. We're set up excellent within. We have all of our safety protocols in place. With that being said, moving on to bylaws, 15.1, 44-20 to adopt a sidewalk patio policy. Deputy Mayor, would you like to read the bylaw, please?
Thank you. This is bylaw 44-20, being a bylaw to adopt a sidewalk policy for the town of Deseronto. And I would like to move that this bylaw be read a first, second, and third time and finally passed this 8th day of July 2020.
Thank you. May I have a seconder, please?
I would second that, Your Honour.
Thank you, Councillor Clark. Any opposition? I'm hearing none. Carried. Next bylaw is a bylaw to enter into an animal control agreement 25-20, extension of agreement town and Frontenac MLE.
Thank you, Your Worship. On this, bylaw 45-20 being a bylaw to approve and authorize the execution of the agreement between the Corporation of the Town of Deseronto and Frontenac Municipal Law Enforcement, Inc. for animal control services for the Town of Deseronto. And I am pleased that this bylaw is read a first, second, and passed this 8th day of July.
Thank you. May I have a seconder, please?
Councillor Smith?
Thank you. Any objection? I'm hearing none. Carried. 15.3. I don't know if we will be doing that today, will we?
Can we do as amended?
I think that's wise. So I move that bylaw 6-20, a bylaw to set water and sewer rates for 2020 be moved with the dates amended to reflect the conversation had by council. And I move that bylaw be read a first, second, and third time and be passed this 8th day of July.
Thank you very much. May I have a seconder, please?
Councillor Smith?
Thank you very much, Councillor Smith. Any objection? I'm hearing none. Carried. At this point in time, I'll be asking for a motion to go into closed session under the Municipal Acts, Section 239.
Everhardis, I move that we go into closed session under one matter under Section 2C, proposed per pending acquisition or dispossession of land by the municipality.
Thank you very much. May I have a seconder, please?
I would second that, Your Honor.
Thank you very much. Any objection? I'm hearing